Morning, sir.
Good morning. Good morning.
Good morning, sir.
Shubhodaya.
Shubhodaya.
That is now our Indian culture. Huh? Oh. Now, I have told you.
Suprabhat.
Suprabhat. Very good. I have last
Namaste.
session. I have told you about the basic concept of the Sujok theory. I think you can remember now, or can I repeat it? Better to repeat, I think
No,
so.
instead of you repeat, let some of the members share whatever they understood. Brief. That will be helpful.
Okay. That is also okay.
Yeah. Anybody would like to share about Sujoku, whatever you know in the brief? Maybe if you want, I can share. Can I go ahead?
No. The other person should do that one, not you.
Okay.
Because you know the things there.
Yeah. Anybody else would like to?
So, can I ask a question?
Definitely.
So, is there any point for reducing of weight in Sujok?
Now that is not a problem. It is not. That is a living style is very important. Not the pressure.
Okay.
Your mindset should be that in order to reduce your weight. That mainly depends upon your food and living things. Only eating is the process will not suffice. Whatever you want, you should not eat. What the body requires, you have to eat. Not for the taste. Then only you can reduce the weight.
Sir, I'm in food industry, sir.
Whatever may be the thing, I will tell you separately. So I will tell you the thing. If you call me, I will suggest the entire thing. I have given you the food chart also. How much you have to take and other things in the previous things. You have to follow. Then only the weight will reduce.
Okay, sir.
Not the other things. Do some physical exercise, very important. Mentally peace. And take the food which is actually required for the body. Reduce the fat content, carbohydrates. Increase the protein. And you have to do some physical exercise also. Not only eating. It is a machinery, God-given gift. It should be properly utilized. That's
Right,
very,
sir.
very important. Then only you can reduce the weight. If you want more details, you can call me and I will talk to you.
Okay, sir. Thank you, sir.
Now, nobody is interested to have the details of the brief account of the Sujok theory. Anyhow, I will tell you briefly. Now, this is the head part, this thumb, and this is the facial thing, and this is the neck, and this is the back of the thing, neck, and this also comes to the spine thing, cervical problem. Now here it is there as thyroids are there, thyroid glands are there, and here you will be having the eyes, and this the face. This is the
Forehead.
face. That is a
Forehead.
and this is the ear part, and then there will be nose here, the mouth, and the chin and other things will be here. Now, in coming to this posture, if you keep it like this one, now this diaphragm, this is the diaphragm, where this ring is there. This is the diaphragm. And above you are going to get the lungs and the heart. Lungs and the heart. Now, the heart is at the center of this area, little left side. And this is the one lung part, and this the other lungs part. This one part. And then we are coming to the central part of your body. You have to keep it like this one. Now here, this portion will be the stomach area, and this portion will be the liver area. And where is there is bulge is there. At this point is the gallbladder area. Gallbladder area. And this one will be coming from the spleen, will be in this region, nearby this one, beside this gallbladder. And later on, now here you can see this one, this portion. Now there is a bone is there. From this, your large intestine starts. So it goes to the vertical, and then to the horizontal, and then to the downwards, and then to this joint. This joint. Now this the anus portion. And for this one, this portion is called as this one is this area, this between, and these two bones. Now this is the, for ladies, this is the fallopian tube, and once ovaries are there, and this portion will be called as vagina. And for the gents, it will be the penis. The urinary bladder will come in this area. And then in this central portion, you will be having the small intestine. Small intestine. And coming to the this one back side, if you fold like this fist, this portion, this first dip and second dip will be the kidney. And here, if you start from this one, not the first dip, the second dip will be the kidney. So these 2 points are the kidney points. And in this portion, this will be starting from this one, sacral point, and where this little dip is there, this is the lumbar portion, and this comes to next to thoracic, and then that comes to here, this is the cervical. That's one thing. And later on, with respect to the fingers in the palm, you have to center 2 fingers, should be kept like this one. Now this is the index finger, that's the left hand, and the right index, right hand is the little finger. And the central one, which is coming to left side, is middle finger.
Other legs.
The right hand, left leg. And
the right leg.
The ring finger will be the right
leg.
Now in the parts, there are 3 parts are there. One is the wrist portion, hand. And then from wrist to this one, elbow, this second portion, and elbow to shoulder, will be the third portion. Now here in this one, if you keep like this one, there are 3 parts are divided, 1, 2, 3. This portion is the hand portion, palm portion, and the wrist joint is here. And from this to this one, this will be the, which one? Elbow part. Elbow part. And from this one to this one is the shoulder point. Elbow to shoulder point is there. This is the front side, which will be called as inside, and back side will be called as the yang side, Y-A-N-G, yang side. The same thing will all the portions in the there. With respect to the leg, there also you can see the 1, 2, 3 portions are there. And again, you observe this in this case in your leg. Now this is the ankle joint. This is the first portion. And then from ankle to knee is the second portion. And knee to thighs,
hip joint.
Up to this one, hip, will be the third portion. So here, there are 3 parts are there. This corresponds to your ankle and this one, this ankle joint. And this one is the front portion. That is this portion, heel, this one. Next. Second one, the opposite of that one is this one. And then this from this ankle joint to which one? Knee joint.
Knee joint.
Knee joint will be the second portion. And from knee shoot to thighs or hip, it will be the third portion. And one thing you have to observe here is, now this portion what we are observing here will be the inside. And this portion from fingers to this end will be the yang portion. And the sides you are getting is this one. Sides of the fingers will be that one. Now, wherever this one, this joining is there, is the hip down in the inside and the yang side. So these are the brief thing that I have to explain before going to the treatment part. If there is any doubt, you can clarify for yourself, okay? Because it's a basic part, you should remember it and you have to implement it. That's very, very important. And at the same time, we will be having I will put in a YouTube channel of my own. So in that one, you have to search for drugless therapy by Satyamurthy. So YouTube channel is this one. Okay, see that one? And you can see, you can go to there. It will give you about 160 videos are there on the health series. You can go one by one, and I think there are 9 videos on this one, Sujok therapy. 6 of them are the theory portions, and 3 is in the treatment part. Okay, you can go detail there. If you are having any doubt, you can clarify here itself, or later on you can ask me. That's one portion. Now another thing is, we have to treat the part of the problem. Any problem from your body can be treated, provided if you are more confident about the part and the disease, what you are having. The symptoms you are having can be treated on your fingers as well as in the palm, as well as on this dorsum portion. Now the majority of them are suffering from various ailments. Although if you have taken the medicine or tablets, it will be temporary relief. There will be no permanent relief. Now the body indicates only the paining point. You will be having the pain in your body, that indicates that is a problem in your body. That is a message from brain to your thing. Now that is to be noticed and then to be treated there. Suppose if you are having some migraine or any headache is there, which part is to be treated? Anybody can tell me?
Thumb.
Thumb should be this one. The best thing is simply just in this area, okay, 360 degrees. Give the pressure like this one, where the paining point is there. Where the paining point is there. Direct that portion. And then, suppose if there is a pain in this region, so pressure it like this one, press and release for a maximum is 1 minute, or till you get a relief from this point. Earlier it will be more paining, proportionately, gradually the pain will reduce. Gradually pain will reduce here, immediately you will be getting a relief from the headache. Whatever may be the type, it may be the migraine or one-sided pain or whatever may be the thing. Even if you are having the tension, anxiety, stress, all the things will be released from your head itself, this thumb head. You have to detect gradually like this one, you have to rotate. Okay? Detect the paining point. That's very important. And then you have to use that one properly.
So one question. Should we do this on both hands or only one hand?
You can do it on both hands. Nothing will happen.
Okay.
One by one you have to repeat. Okay?
All right.
Now, the thumb is enough for you to relieve the migraine or any pain, headache. And if you want, you can also use the other one. The same thing can be done there, here also. Okay? It's a very simple method.
So how many times are there?
If you get to one, but if you do it for one time, it is enough. If still persists, leave some time, 1 hour, 2 hours, again you can do it for yours.
Okay.
Or alternately do this one and this one. Left thumb and the right thumb, that's all. Whenever you feel, you can do that. And if anybody feeling that there is a headache is there, strain is there, anxiety is there, just pressure it you for this one, yourself. They will immediately get relief, like a magic, without any tablets. That's very important. So this one point. And according to our Sujok therapy, we have to take this probe, we call it as metal probe. Huh?
Jimmy.
Jimmy. This is the probe we generally call it as. Now, here what we have to do that one. Now we have to, mainly you do this way in this region first, pressurizing that one. So observe how it should be kept. The probe should be kept. Okay? So it should be kept like this one. It should be held like with the 2 fingers and rub like this one. Give only the pressure on the sides. And actually you will give the pressure at the center. Okay, it's only the support. Is it clear? And you can do like this one up to 360 degrees and observe where the paining is there. Where the paining is there. Suppose if there is a paining in this area, so just there, because there is imagine there is a pain is here. So I am rubbing and observing the pain, maximum point, okay, where the pain is there. Just take a sketch pen and it will be marked like this. Now, take the methi seeds which is given to you in the health kit, and then take the meditape and open like this one. There is a gum is there here, and you can take the methi seeds on paper or table, and spread like this one and open this one. At the center portion, you should dip like this one. The methi seeds will stick up. Okay? Leave some space on the left and right. It has to be gummed, that's why it should be left. And how much tape should be required is taken and cut it to by a scissor, which is provided to you. You can see this one. The gum is in this portion. That's medicated. Nothing will happen. So put on the market point and then do it as lightly as possible. How much pain you can sustain or the patient should sustain. And pressure is here. So it should be firmly fixed, tightened, and then it should be given the pressure. Okay? You feel some feeling on this area where the paining is there. Some oscillations will be there. That is, it is treating. Now gradually the effect in this one will reduce and your headache will also be reduced proportionately. And if there is still pain is there, just pressure it here on that point. How much pain can be sustained should be given. Don't too much pressure should be given, particularly for the children. Okay? Because the skin is soft and the muscles is also sharp. So you have to only apply this one. And as far as possible, for the children, particularly 5 to 6 years, just simply give the pressure from your fingers. That's all. How much pain they can sustain, that will be relieved enough. Don't apply any seeds or on that one. For adults, you can do like this. Okay? Preferably apply in the night, and in the morning you have to remove that one. Don't put water on these fingers, because it's a paper one, it will spoil one. Nothing will be affected for you. That's why you should be careful in doing that one. Is it clear? Is there any doubt in this case? I think that I made it clear.
Clear.
Okay?
So now you're putting a methi around the pain point, surrounding.
Surrounding. At that point also should be
Including
covered.
that point.
Ah.
Yeah, that's like center. Okay.
You can also put only single seed.
Okay. Ideally, it's like that. Okay.
Huh?
Yeah.
Suppose
Ideally,
if
if
there
you
is
spot the
seed,
point
so
correctly.
there is pain is there,
Hmm.
you can't detect. Huh?
Yeah.
So it will be common. It's very easy to locate you also.
Okay.
Huh? The same thing will be applied in this case also if there is pain in this area. Wherever the pain is there, you have to apply like this. So is it clear?
Yes, sir.
So after the getting up, just remove this one and throw it into the waste box. Open this one and just fold like this one and put it in the waste box. It cannot be reused. The energy which is having by the seeds will be lost. And the gum will also go away. So let us be only single use. And we are also provided with you magnets. In the kit. This is called as the star magnet. This is called as the star magnet. For this one, I will tell to open that one. Now you can see this one. This is the black portion. And this is the white portion. This is a metal portion. Okay. Now actually this is the magnet piece. It's a magnet piece. Now you have to fix this one on the tape. Only one magnet or two magnets which covers that area will be important. This portion should be fixed on the center of this one, tape. Okay, you have to leave space on both the sides. So just cut it off how much tape is required for you by the scissors, and you have marked the point. So keep this white portion, metal portion, on this point, like this one, and then cover it tightly. Now we have to pressure this point. There will be paining will be there. It will give more pressure in the magnet than the methi seeds. It will more beneficial if you use the star magnet. And if it is not available, use the methi seeds. So this should be pressured like this one, as in the case of methi seeds, but here you are pressing only the magnet. Okay? It will be more painful. But you have to give the pressure how much pain they can sustain or you can sustain. So pressure it a little while, a few seconds. Immediately the headache will disappear. This is again applied in the night, and you can remove this one. But one thing is, you have to keep the magnet for storage. It should be stored. It can be reused. But one thing is, you have to this one is, if you use this magnet for yourself, it should be used for only for you, not the other persons. It should be taken in a small container, plastic container. Don't use the magnet. It's a steel and other metal part, this one container. Only use the plastic. Okay? And it can be reused only for you. Suppose if you use it for your wife or in any family member, they should keep it themselves. It can be reused for them. And no expiry date for this year. This one. You can store for this one, for entire your life. Provided if you keep it properly, free from the places where the magnetic property will be lost. So after this one, in the morning you have to remove and you have to store this, remove this magnet and store in a plastic container. And another important thing is, if there are any children in your family there in the house, it should be kept out of the reach of children. There may be side effects will be there, they will swallow and other things are they put somewhere else. You cannot detect properly. So that's why you have to keep it very carefully. It can be reused. But in the case of seeds, only you can use and throw it away. Single use. Is there any doubt here in this case?
No, sir.
No.
I have one doubt.
10.
In the kit, we keep all the items. What are the Sujok items? But if you wanted to, can you spotlight me also? Just wanted to show one instrument. Since can somebody spotlight me? Satya sir or Ramesh sir? Can you please spotlight me? Just wanted to show that. Yeah, this one is a magnet. So if this one is kept into the works, that magnets will be any problem?
Actually, it should be kept in a plastic container and you can keep it.
Okay, even both are together, no problem.
Nothing will happen.
Okay,
Because
thank
it will
you.
not be attracted. You can see that.
Okay.
You can see that.
No, cover is not there means directly cover is not there.
Without cover, you should not wear. Of course, you can remove this cover and you can see test also.
Okay.
Nothing is there.
Okay, right. Thank you. Yeah, I used to wonder whether I should do it right or not.
No, that's why I'm demonstrating you.
Okay.
I have to clarify your doubt. That's very important.
Yeah.
That's
you,
why
sir.
it is a class.
Yeah. You can remove spotlight, sir. Thank you.
Because sometimes entire thing should be kept in that one itself. Is it so? So in that cases, you have to be keep like this one. Then nothing will happen to you. Your magnet will be safe. So this is one other thing.
So for knee pain or varicose veins, what to do?
1 minute. I'm demonstrating one by one. Okay. First, you have to observe where the knee joint will be there in your fingers. First, you have to see that one. Which portion will be coming? Detect that, whether it is on the right leg or left leg. You have to decide that one also. And another thing is, if there is pain in this region, that's yang side, this yang side. Now it should be taken, this is the knee joint. This is the inside, this is the yang side. So to treat, observe only in this area.
Got it.
In the yang side. Anyhow, better to have detect in this area also. Although there is a pain is here, but there may be problem in this area also. So I have to detect entire thing. Or else, take the methi seeds and apply in the entire area. Apply it to like this one. You should cover the entire knee joint without any detection. Okay, safer side. More methi seeds should be required than nothing to worry. Your problem should be solved. That's very important. Without medicine. Immediately they will get the relief. But it's not 100% and it should not be cleared in a single day. It should be continued. It should be continued. Is it okay?
Okay. One question.
Another I will tell you. I have clarified with respect to knee joint. I have not covered this one. I have the varicose veins.
Yeah.
Varicose veins will generally appear in the calf muscle area.
Yes.
Particularly in the back side. This portion. In this portion, or it may be spreading here, or it may coming upward or this one inside in all the areas in this area.
Yes.
This is the main point, this portion, or on this side, or on the center. Generally, on the calf muscle is very, very more. And later, if you leave that one, it will spread to entire thighs. That's very important. Where the places is there, you have to detect in the finger. Where it will be appearing. So only in the yang side it won't appear, only in the inside. So this portion is the inside of your left leg and inside of your right leg. ring finger. And suppose if it appears on the sides, you should go on this area or this area on the left leg, in this area, and in this area on the right leg. Okay, if there is any in this portion. If there is in this portion, then you can directly apply here in this case.
Yeah.
In this region or in this region, left or right. What is the other? If anybody is having another problem, anything there? Mainly the knee pain will be more in majority of the persons, particularly aged persons. After 40 years, they will get the knee pain. There are various methods are also there, alternative medicines, Nelly. But I can't, I am reaching out with the Sujok method now. Now suppose if we are having ankle joint pain, where it is to be treated? Ankle joint. Suppose if it is on the right side of your leg, which finger should be selected? And then where the point is there?
Ring finger, ring finger and the first joint.
Ring finger?
And the first joint.
First joint, very good. And where it is to be treated, detected first?
On the sides.
On the sides, particularly in this region, on the young side.
Okay.
And detect if it is not available in this region, particularly on these joints, sides, and at the same time, observe here also, there may be light problem in inner side of it. Okay? And if there is pain is there. Okay, mainly it will be there here, or sometimes it will be there in this region. So better to detect this entire area. Okay, sides, and then the in and the young side where the paining is there, and then apply the magnet or the methi seeds. You will get relief immediately, but it should be repeated till your problem solves. Repeat the process till the problem solves. Now, suppose if you are having an elbow pain, for example, tennis elbow, where it is to be treated, where it will be appearing for you. So in the elbow portion, whether it is on the right hand or left hand, you have to decide first. Right hand or left hand. Then select your fingers. Which finger? These two fingers.
Index or little finger.
So if it is right side, which finger should be selected?
Index finger.
Index 9.
Sorry, little finger.
Little finger.
Because you are keeping like this one.
Yeah. Little finger.
Little finger.
And second joint.
Second joint, you have to go here. And in this portion, whether it is in the young side or inside, you have to decide for that one.
Yeah.
Now suppose it is in this area, it is young side. Young side means you have to go for the back portion.
Yeah.
Back portion. So in this area, you have to detect. And at the same time, you have to also detect the sites also. If it is not available there, the pain is not there, you have to come to the yang side. Which portion yang side? This one, this area. If there is pain is here, you should go for this area, inside. Anyhow, you have to detect the entire area and detect the paining point and apply the magnet or the methi seeds which is available for you. So this another important thing is, suppose you use a magnet to other person, don't ask them to take it out. Okay, ask them to get it you. It should be given for them. Don't take it from him or her. It should be given as a gift or anything there, depending upon your friendship or relation. These are the some important things that should remember for you. Suppose if there is a paining in the thighs area, thighs, that's the right leg or left leg, you have to decide which fingers will be used there.
The ring and the big finger.
No, not this one. Middle finger and ring finger, correct.
Yeah.
Middle finger and ring finger. Area, which one you have to decide for right or left.
Yeah.
Suppose if it is left, which finger should be used?
Middle finger.
Middle finger. Which is the thigh area?
The last part.
This last part particularly, this will come in this picture, sideways.
Yeah. Yes.
And if it is in this area, so in this way, yang side, sorry, inside. Mainly it will be appearing in this area, inside and the sides. Majority of them. Very rarely you will be appearing in this area. Anyhow, we take both the area and treat wherever the pain is there with the methi seeds or any magnet. So this another thing is, suppose is there any problem particularly in the stomach area? In the stomach, for example, acidity is there, gas formation is there, and indigestion is there, all these things will appear there. Which portion should be treated there? So where there is a central mark is there, so little by side this one, it will be stomach area. This area, if you feel like this one, or this the main stomach area portion, you can also go in this side also. So this area will be the stomach area. Okay. If there any problem in the stomach, you will be having the pain here.
One
pain
question.
here. Okay. Pressure it by your simple finger itself and observe.
One question.
Ah.
See, this is one is the head portion, right? Then this is we see the diaphragm. Diaphragm is there, this line. Then above is actually lungs will chest will be there.
That's one thing. Okay, you are correct. But what happens is sometimes you are not in a position to detect in this area. Because it is little hard when compared to this area. So this is only an alternative method for you to detect, not by the Sujok method. Okay. Another acupressure method is there where we are treating here itself. But this should be indicated for you for the treatment. Suppose if you are pressuring like this one, you won't feel pain there, generally, in this area. That's why we are telling to go here and pressure like this. You can use this one also. You can also this one also. This type, that one. Okay. And you
Can someone
can
just
also
mute?
use this one also. In certain areas, it can be used. Okay. So in this area, generally it will be paining point, this particular portion. So that's why I'm telling you little alternative method for you to treat the stomach area. If it's available, it is okay, nothing will happen. But it's very difficult to find the point here because you have to give more pressure in this area. You can see for yourself in the palm itself, this will be a little hard portion is there, and this is very soft, you can detect easily. That's a clue for you. That's one thing. So what is the other thing, problem you can face that generally?
I have one question.
Hmm.
See, yin and yang, how to identify in the palms? It's very, sometimes very, see, one side is a black, one is a white one. So how to identify that yin and yang easily?
So this portion will be shown to you. Is it clear? It's only the border side where the white and black will join in there. Okay. And this portion is yang, actually, it's a yin, and this portion is yang. It's only the sideways where the yin and yang exists.
But in
Okay.
the physical parts, which is yang and which is yin, how do I identify? In the physical
Now
part.
this went to a white portion, we kill it as light. This portion will be the yin, and dark portion will be called as the yang.
But in the hand, how do you see which is both will be same, right?
No. I will show.
Yeah.
This the hand, this portion. If you keep like this one,
Hmm.
this entire portion will be the yin side.
In portion.
How we can say that in portion? Because of folding, only if you're able to fold it. See, this finger
Whatever
also.
we think, I just first clear this one. It's from tip toe of the fingers to the shoulder point. This portion will be the inside if you keep like this one. Is it clear?
Yeah.
Now you have to go like this one.
Hmm.
You can see the difference in the surface area.
Okay.
Now this is the yang side.
Okay.
This is the inside and this is the yang side. And suppose if there is any problem, is there nothing to worry? Suppose it's the left hand, is it so? Suppose if there is if it doesn't observe any paining point here, go for side. If you don't have that one, go for this yang side. That's all.
No, one more.
It's a common sense.
One person told me, see this finger, we can fold it, isn't it? Similarly,
that's of course.
in our body parts also, whenever we are folding it, leg can be folded, hands will be folded.
Of
What
course,
are the folding
definitely.
inside will be that white one, and other one which is not able to fold it. You can't fold back, right? You can fold only front. That's what somebody told me.
That's also another method. I'm simply explaining. I'm not complicating you.
Okay.
I'm not complicating because this is an elementary class. Afterwards, we can go for other things.
For feet, how do you identify in and yang for feet?
For feet, this one is this area will be the yin.
Okay.
And this area is the yang.
Okay.
You stretch like this one. Like this one, this portion is the yang.
Okay.
And the bottom portion is the yin.
Yeah, it can be folded, folding side. Yeah. Okay. Thank you.
For
No,
one
just I'm
question.
asking question. It will be useful to all the people. That's what I'm asking the question.
Okay, that we should not give more complications. Alternative methods immediately we should not implement. Only when one method should be given there. After specializing that one, if you tell another thing, they will not be confusing. That's why I'm telling you. It's a basic part. There are various methods will be there.
Sir, one small request.
All of them are not known that one. That's why I'm simply telling you the simple way.
Yes, sir. My one
If
request.
you take alternative, give this one, they will confuse.
Yes, sir. Now time is actually 8 o'clock. So at least give us the 5 minutes question and answers. Then take the next session, sir. Next week
No,
session.
I'm not telling you that I'm not answering you. I will answer your question and answer all questions.
Yeah.
What I am telling you, we should not confuse the other persons. That's
Yes,
all.
sir. Definitely.
Huh?
Yeah. Now
Sir, one
suppose,
question.
3 minutes of question Q&A. After that, next week we'll take some other topics.
Oh, that's one.
Thank you.
Sir, one
Somebody
question.
has told me.
Yeah. Star magnet is there, right?
Which one?
Star magnet.
Ah,
Star magnet, it has two faces, right? I mean, which face has,
definitely black and white.
yeah, black and white. So which should touch the skin?
Now
On the
this
fingers.
white portion should be touched to your skin point.
Okay.
And the black portion should be stick to
Face.
on the gum.
Okay.
Gum tape. Okay.
The white one,
demonstrated
the
you.
white side will be sharp also.
That's why that should be activating your magnet. This one.
Yeah. Right.
Organ will be activated like this one. That's why I'm shown to you clearly. Huh?
Got it.
Applying at this one.
Yeah.
Any doubts are there or any point should be mentioned further? Because there is various points in the body. Parts are there. All parts should be treated only in your hand. That is very important.
Sir, for eyesight improvement.
Eyesight improvement. You know the area where the eyes are present in your thumb.
Yeah, okay.
Okay?
Yeah.
And if it doesn't know anything there, one thing, you have to keep this on a hard surface.
Yeah.
In the hard surface, and then apply this here, pressure there.
Okay.
Like this one. And you will feel some paining points on this side, on this side.
Okay.
So again, take there and pressure like this one, like this one. And while using the probe, don't take it and pressure it 90 degrees.
Yes.
It will affect your organs. More pressure will be applied there. Don't do it that one, only 45 degrees sideways, so to pressure it.
Okay, sir. Thank you.
So on both the sides, you can, if you are having any pain in both the eyes, apply on both eyes. Okay, points.
Okay. Okay, sir. Okay. Thank you. Thank you very much.
Do only one eye, which is problem is there.
Okay, sir.
And if there is any ear problem, so where there is this
Sideways.
you have to apply this one. In this area, it will be paining. This joint is there, nails, and that area, and this area. It's very easy thing. And at the same time, if you can also rub like this one.
Oh.
It's very easy where the paining is there. Like this. In the beginning, apply little pressure, and if there is no paining is there, give more pressure. Little increase. Particularly for ladies, don't apply too much pressure as the gents, because their body is very soft. Apply little pressure, and then if doesn't get any pain, apply more pressure, little, such that they can sustain it. Even in the applying of the magnets and other things also, ask them how much pressure she can sustain. Don't apply too much pressure as you are doing for yourself. Even for the children below 5 to 6 years and other things, just do it to your fingers itself. Don't give too much pressure. Don't apply any magnet, this one, probe and other things. Just if you simply pressure it, they will feel the paining point. Just pressure it and release, that's all. A few seconds is enough for them.
Sir, for if we apply pressure on these, can you also reduce the specs?
Reduce?
Reduce the specs
Critical power.
number.
Sight.
Eyesight.
Eyesight can be
Improve.
reduced.
Yeah, improve the eyesight basically.
Definitely. If there is any paining point is there.
Okay, cool.
Suppose if there is any shoulder joint pain is there, which part should be used?
Left. Forefinger bottom.
Either you can use, if it is, decide first whether it is on the left side or right side. That first thing is, which finger should be selected? Suppose if it is a right side, then you have to use little finger.
Yeah.
And if it is having the on the left side, you have to use the
First finger.
index finger.
Finger.
Index finger. Okay. And the bottom portion where the joint is there, finger joint. Okay. This portion will be the shoulder point. And the left side, left hand side. And this will be the right hand side. Okay. And if you don't have anything there, just take the probe and rub like this one on that area. Right side or left side. If doesn't know anything either whether it is a left hand or right hand, just do for both the things. Very simple. Okay? Wherever the pain is there, you can apply that one. Don't confuse for yourself. Do for on both the hands, that's all. Where there is pain, you can apply this magnet or the methi seed, that's all. Whether it is in the yang side or inside, there is a different question. You are learning. Don't hesitate. Treat the entire area first, where the paining is there. And then apply, that's all. If you confuse, the patient will also be confused. They won't believe you. That is very important. It's a psychological effect. Therefore, you should be confident for treatment and then you have to treat. If you are having any dilemma, don't treat that. Okay? If you are properly having the confidence, go for treatment. Then they will believe you. A psychological factor will be there. It will definitely get the relief. So those things should be happen to that.
Sir,
Any
are
other
these
questions?
details available with your YouTube channel?
Which one?
Are these details available in your YouTube channel?
Definitely in the theory portion, it is six videos are there.
Okay,
Till
okay.
of
Thank you,
20 to
sir. Thank
30
you.
minutes in each session.
Okay. Thank you.
And then treatment portion will be the 3 videos are there.
Thank you, sir.
Okay.
So I am
Okay.
also leaving.
Thank-
Thank you very much, sir.
Okay.
Thank you. We are stopping the live session.
Okay.
No, yeah, we'll meet
If
you
you
in the
are
next session,
feeling
sir. Thank you very
okay,
much.
then I am okay.
Thank you, sir. Thank
If you
you.
are
Thank you very
having
much.
some questions,
Thank
I
you,
can go
sir.
further. That's all. No burden will be there for on both me or as well as you. You should enjoy it. That's all. Session should be enjoyed.
And lot of learning, sir.
Then only you can remember something.
True, sir.
You should serious, of course, in learning, but don't serious about the smiling face should be there. All other things should be there generally. Then it will be lovely and you can remember it more precisely.